Hello everybody, my name is James Willis. I'm Head of Clinical Sales for BUPA UK and I'm going to talk to you today about demonstrating ROI value to your board. Bit about me, I graduated with a sports science degree decades ago, unfortunately, and you can tell I'm not really focusing too much on using some of that knowledge at the moment. So I've been in wellbeing since 1996. I've worked for Nuffield Health for 17 years. I've worked in most major corporates delivering wellbeing services for them, and now I work for BUPA as Head of Clinical Sales. My parents both worked in the NHS. Neither could quite understand how I work in the dark side of private health and medicine. But they're sort of slowly coming to terms with the way that we work together. We've been working on, I guess, 2 years worth of data. So we've been looking at 148,000 health assessments over the last 2 years and building a picture of what that looks like for your employees and the consumers that buy our health assessments. And what we're going to look at today is the way that we can use that study and some ROI modelling that we've built and developed to help you build some ROI cases for your own businesses. So within all organisations, there's a requirement to manage people, to manage budgets, to manage well-being, and you need to juggle those priorities, and it's really kind of quite conflicting as to which areas you're going to focus on and at what time you're going to do it. So for me, it's about how do you promote those services? How do you not only make sure that they are, I guess, morally right to deliver to your employees, but actually financially viable? So I'm briefly going to take you to this 2 years worth of data. I'm going to stop turning around and looking at the screen because I keep cutting the microphone off, so apologies. And I'm going to give you an insight into that value of wellbeing. So data is your key to success. I think without data, you are unable to prove the value of any of your programs. And actually, whether you're proving your program is working or you're proving that actually it didn't work and you can move on to something else, it's still really important to get that data, to get that information and use it to stimulate discussion within your organization and to drive your wellbeing agenda forward. So you've got a wealth of data. You've got health risk assessments, you've got reward platforms, you work with intermediaries, you work with us as suppliers. You have EAP services and psychological services, PMI schemes, health trusts, app data, health stations, national studies. REBA produce some great work. There's loads of information out there. It just needs to be harnessed and used in a way that's kind of quite meaningful. And to get to the point of where we are today, in 2016, to take a bit of a step back, BUPA redesigned their health assessments, and they did that with a very specific reason. They wanted to make it more current. They wanted to make it more open to people. They wanted to stop over testing. They wanted to, I guess, make it more targeted and more driven, empower people to make the decisions in the way that they look after themselves. So we stepped back, we looked at everything. We wanted to be really clear that with the health assessment, there was a really clear outcome for the individual that was partaking in the health assessment, but there's also some really valuable data for you, the companies that are purchasing it. So every test can be measured, every reaction can be measured, and actually we can start to build some really important data. The key for us is how we then look at this value of the product and ultimately give you the return on investment data that you need to I guess to promote to your shareholders, because ultimately, whether it's your shareholders, your stakeholders within your business, you have to be able to justify why we're doing something. This is the first time that we've shown the data to anyone, so you were the first guinea pigs, so thank you and bear with me. We have kept it quite high level because we've got 20 minutes. And I didn't start my timer, so I have no idea how well I'm doing. So that was a good start. So we wanted to be able to, I guess, help you define what wellbeing looks like in your organisations. So health assessments are often seen as quite a standard benefit. It's quite a hygiene factor. Everyone provides them, lots of companies buy them, but actually, do you really use that data for what it's intended for, which is actually we want to get your employees healthier, we want to get them fitter, but actually you as a company then have a wealth of information that you can utilise to then do something with to build your health programmes for the wider good. So we've used this insight into our 2-year study. So that's 148,000 people. We saw more than that, but actually this is 148,000 records that are of usable quality. We've looked at self-reported sickness and absence in relation to the medical data that we have. So we can actually then see quite clearly some great correlation between various elements of sickness and absence and the medical outcomes that we see in the assessments. We've broken that down into 3 key areas. We've broken that down into mental health, which comprises stress, anxiety, depression and sleep. Physical health, so BMI, nutrition and physical activity, and social or arguably antisocial habits of alcohol consumption and smoking. So to get the data, we have all our health assessment data. We introduced coaching calls as well as part of our health assessments in 2016. Those coaching calls were designed so that we could measure not only, well, 2 things. It was designed to help people improve, and it was designed to measure the outcomes at the health assessment at 6 weeks and 12 weeks. So what we can start to see is a real picture of someone coming for an assessment, seeing some improvement at 6 weeks, and seeing that sustained improvement at 12 weeks. And what we've then done is we've overlaid some nice studies, CIPD data, Department of Health, and various other studies, overlaid that with our information so we can start to give a true financial kind of return on investment. So not really seeing that elsewhere in the market at the moment, so it's great to be able to finally put a financial figure on where we see health assessments, and then ultimately how you can use that as a tool for providing ROI to your businesses. I've had to condense 25 slides into 3, so I'm going to keep it quite high level, but we will be expanding on this, and we will be building it into a more published piece of data, so you will get access to that as that comes out. So mental distress has always been, I guess, had a negative impact on sickness and absence. We see that in published data, we see that in PMI claims, we see that in our EAP services, in our occupational health. We know that it's an issue and we know that it causes problems. Being able to link that to our health assessment to see how people are working is a great step forward. Looking after the mental health of your staff is really critical to, I guess, cutting down on the cost that mental health brings to an organisation and the personal anguish that causes that person as well. So I said the findings are reported on self-reported data. We are seeing that with that self-reported data, people are really underreporting. They're really underreporting the levels of stress that they're experiencing. That's not unusual. We know from studies that it's a known issue that people will, I guess, underreport on stress and a number of the other anxiety and depression areas. Interestingly, we see that reporting for higher levels of sleep and low levels of sleep also almost have the same degree of sickness, which is quite interesting. So extremes either way of too much and too little are affecting customers in quite a significant way. When we look at stress with our coaching calls, 63% of customers chose to focus on working on their stress as part and parcel of their individual goals. And as a result of that, if we apply that model to our ROI model, and we apply that to our corporate book, we can estimate that that's about £9 million worth of savings per year that we're seeing as a result of the BUPA Health Assessment and the coaching call. Now that's quite a significant figure. And Nick and Andrea will be outside afterwards. They've got access to the model. We can plug your figures in and we can see what that looks like for you as an organisation as well. So at a basic level, focus on providing EAP services, which I'm sure you all have, is part of your culture. But my question is, do your employees know how to access the EAP services? So many of you provide those EAP services, but do you know how to do it? the amount of times that I get asked within my organisation, what's the EAP number, and we provide the service to other customers is unreal. I don't suppose that's different from anyone else. If customers or clients or your employees can't find that phone number when they need it now, how are they going to find it when they're in distress? So how do you make that part of your culture? How do you make that part of your kind of go-to product that is there in the background? We see on average 3 to 4% uptake, which is not unusual. Some of our companies that work really well will see 16 to 20% uptake. So very much depends on how you promote that and how your supplier works with you to promote that as well. With mental health, there's also a real key link with your occupational health service. So what we're seeing with occupational health is, when we work with customers, there's a real difference between what your policy is on how you as businesses look after mental health or report it from an occupational health perspective, and then how that translates into reality. So as an example, we worked with a customer that has around 3,000 employees. Their policy is that mental health related sickness absence is escalated at around 7 to 10 days. It was 10 days is the actual policy. When we actually broke down the data, which we can see, it was actually closer to 20 days. So what we're then looking at is and applying the average salary for that company, and actually we can see that they are wasting £5 million between not reporting that individual, or not reporting is the wrong word, not escalating that to an occupational health service instantly versus 20 days later. Working with them on that, we cut their bill by almost 2/3. So actually, there's a real importance to, I guess, apply the policies that you have and to think about the implications and the investment that you're already making, and can you cut down those costs from one area of your business and translate it into another area. I guess from a mental health perspective, we've had Mental Health Week, and I'm sure you all did something for Mental Health Week. There was lots of things going on within London, lots of talks, lots of great engagement. Lots of these green badges everywhere in the city. They were everywhere. Haven't seen one today. Today is all about diversity and pride, and that's now this topic for this period of time before we move on to something else. But actually building that mental health awareness as part of your agenda and keeping it focused and current is really important. Mental health first aiders is a really hot topic at the moment. And John Madden and Poppy are doing a fantastic job over at Mental Health First Aid England in promoting that. Within their website, there's a huge wealth of information and data that you can utilise to help, build that picture of what it will cost you to put those services in place. Rely on your suppliers to give you some of that ROI information. Looking at the resilience of your employees is also really important. So, do you understand how resilient your staff are, and do you understand each level of your business, be that your ground worker, your manager, and your senior manager? So there's different things that you should be doing to look at how you can translate that into, actionable hard work to save you as a business money. Because we're seeing huge levels of absenteeism on depression, stress, anxiety, and those are costing you as a business quite a significant amount of money. Make sure all the products you have link together. This is really important. We see lots of really disjointed products where a health risk assessment could be different to your health assessment, could be different to your PMI, it's different to lots of different aspects. Try and get some consistency in the way you're linking your products and services together. Because ultimately, we all respond to different messages in different ways. No one picks up the same message in the same way. So if you can trickle that same message throughout your products and services and signpost nicely back and forth, you'll see a better uptake and increase uptake and activity. Sleep I've not put down as a specific graph because it was all over the place, but sleep was quite an interesting one. 7 hours of sleep was the most common and had the least number of sickness days at 4 days. People that slept too little or too long had about the same. So people that had 4 hours and 9 hours sleep pretty much had the same level of absenteeism at around 9 to 10 days. So quite a significant number of absences linked to just sleep. And sleep's often seen as one of those things that you should do something about. Well, it's in the background, but not actually something that we do. So building that into a health assessment program or into your EAP. Most EAP providers will have some kind of online program to support your staff, but it's making sure that you're aware and how you signpost people to that is really important. You already pay for a number of these services, so don't feel like you should not use those services. I'm until 5 minutes and I'm way behind, so I'm going to stick to my script. Physical health, really interesting. Really, this graph is about excess. So too little, too late. Too much, too little. We're seeing the same sort of thing. So people that are unhealthy in nutrition or overly excessively looking and focused on diet, we're interestingly seeing both people taking higher levels of sickness. Now that's a real interesting one and one that we need to look into more detail. BMI is imperfect, but people that have really low levels of body fat seeing almost 6 days absenteeism, going up to almost 10 with that 40 plus. So there's a real interesting link between those two. And actually we're seeing 70% success rate on people that focus on that with coaching. That equates to about an estimated 6.5 million per year across our book. Physical activity, we're seeing, BMI is 70%, that's 6.5 million. Physical activity, we've seen a 72% improvement on people that chose to focus on increase in their physical activity. Moderate exercise is not seeing much of a change. So it has to be a high level of high impact exercise. That equates to about £51.5 million worth of savings across our corporate book. Antisocial habits. I think alcohol, interestingly, really underreported. I don't understand that, and I will discuss that with you more in later with my one glass of wine that I have per day later on in the bar. We've seen people that focus on alcohol reduce their intake by almost 11 units. That's a bottle of wine a week, and there's significant impact to businesses with that. Smoking, you're seeing around 6.5 days per year. The key thing for us is how we now link this together to understand whether drinking and smoking have a more combined piece of work compared to the others. So final slide. I think I've sort of touched on it before. Utilising your existing networks is really important. You've got some real great providers within your the businesses you work with. They have huge amounts of data. You shouldn't feel like you have to supply all that data yourselves and build that case. They can give you a lot of information. The question to you is, do you truly know what your business issues are? So interestingly, we see lots of companies asking us for ways to tackle issues. But my question is that the right issue to be tackling in the first place? Have you looked at your employees and do you understand that that is the most important? It's frustrating when we work with companies that have so many different things going on and none of them are joined up. If you work within your organisation and one part of your business will focus on something else, one part will focus on another area. If we can pull those together, we can exponentially increase the value to you as a business. And working together with your all of your providers in a round table discussion is really useful. We see amazing value when we sit down with different PMI providers or fitness facility providers and have that discussion with our customers on a regular basis. We will happily work together for the value of our customers. If you don't have budget, and not everyone does, think about using something like health risk assessment. So we've worked with some of our companies that want to spend a little bit of money to really understand how they can target their entire business. So starting point, health risk assessment for everyone, understand what your issues are, start to build that wellbeing program, start to think about how we can I guess, support you, and how your other providers can support you. your return on investment information will only be as good as the people that are using your services. So coming back to EAP services, no one using them because they don't know about it. It's not accessible. The phone number's not on the front page of your intranet. Health assessments. If we phone our customers to book them, about 68% of people come. If you as a company say, I want my employees to phone you, about 7% of people come. So saves you money, but actually you don't get the return on investment either. So there's a real kind of partnership approach to us helping you with your budgets and going from there. So I think key things for me, link your results together, work with your providers. Ultimately, as your suppliers, we are here to support you. So use us and we will help you with that ROI. Thank you very much.